Hey, do you mind if I put you on speaker for the gentleman? This is Morgan. He's gonna be running some stuff.
Hi, Morgan.
It's that one of our discipline. We probably be on pre-recorded video. And asked me to share that from my side.
Right. So I think what I'm gonna have to do on this end is it's just gonna have to, I'm gonna have to put, it's gonna be like a giant Zoom call. So I'm just gonna put the Zoom up on the screens and have the audio go through the house here. So
Sounds good. I kind of think we take the message would be when put into call and make sure we're all on the same page with the things.
right. And yeah, I think we should be all good as long as I think if Scott's talking, obviously, yeah, if he can, oh, I see him on there. Okay, so
Yeah, he's up there.
yeah, we
We're
could
gonna play his pre-recorded video.
right, okay. Yeah, so I'm assuming you're just gonna share your screen or something like that and play it. Okay, sounds good.
Thank you.
Thank you.
Okay, thanks for calling, Morgan. Bye. Yeah, Morgan's like almost gave birth yesterday, so we're lucky to have it working now.
Right. Oh, wait, we should do headphones here. Headphones.
Hi, Scott. I don't know how much of that you heard, but what we are going to do is we're going to broadcast your pre-recorded video, and then we're going to have you join us for the Q&A live. Oh, you're muted, Scott, but I think I saw the head shake.
Yeah, I didn't hear any of that, but I appreciate the recap, Morgan. That makes sense. Do you want me to disconnect and connect
So we're
back
not
in?
gonna hear them until I turn the volume up, which I'm assuming
Yeah.
I don't want to do yet. Right.
Correct,
Yeah.
thank you.
No,
Okay.
Scott, you can just, Scott, you can stay on. Just maybe if you want to just turn off your video until we get to the Q&A portion.
It's not like today. Today
Like
it
that all
is.
the time. It's probably just because I'm new to the place.
But she's gonna share, so I'm gonna pin her. So that way we don't have that. You know what I mean?
Yeah.
Windows popping up when someone's talking, when Scott's talking, I guess. And, yeah. Great.
Okay. Scott, can you hear me? Is there still an echo?
Stephanie just called. Friday to get out.
Right.
And he had Andre is like. For tomorrow, she was flying here to Michigan, and Michigan to Reagan, and they just canceled the Michigan to Reagan. Yeah. So far, my flight is okay.
Yeah, you're okay, because
Yeah, because I'm only going
you already
halfway.
had your scroll through. the
Yes.
time already. This is a. That's not what.
Let's see.
I have the
Hello.
Is everybody ready? That was a good session, right? And you guys have been in it for a while, so for you to say you learned stuff, that's good. Okay. All right, if I can get everybody's attention. As I've said many times, if I can get everybody to be quiet for a second, this program has really been on thriving and surviving. And we have a wonderful patient panel of people that I think are really exemplary in doing just that after their bladder cancer diagnosis. And we're going to talk to each of them individually. But I have Morgan zooming in, and Scott Erickson is the first patient that is going to, first individual who has a bladder cancer diagnosis in his life, who's going to share his story. And we weren't quite sure if he was going to be able to zoom in, which he looks like he is on, which is very exciting. He's in Poland competing in track and field. So we made a video recording. So Morgan, are you there?
I'm here and ready to share Scott's story.
Okay, so if you could share Scott's video, let's watch that, and then we're going to talk to everybody in the panel and open it up, and Scott will be there for questions.
Hey, everybody.
Hopefully this
Great
will
to see
work.
you all. I am recording this from, of all places, well, actually Texas, but it should be Poland, because right now, as you're watching this, I am in Poland at the indoor World Championships for Masters Track and Field. So it's an honor for me to be able to speak, even if it's pre-recorded like this. So I want to share a little bit of my story with you, and the journey that I've been on since being diagnosed with bladder cancer. I was diagnosed right before my 60th birthday. I was competing in Masters Track and Field for the last 5 or 6 years or so, and like, you know, a lot of us, maybe all of us, the diagnosis completely blindsided me. I was lucky in the sense that I got involved with
You know, Scott's here. He might just be willing to share his story as it is, since this video seems to be having trouble loading and playing.
If we can the video, that'll be great. And Scott, if you can hear us, why don't you give us a synopsis of your story? You don't have to put your video on, because I know that you're in Poland and you may not have good connection. Scott? Oh, Scott, we need to unmute you. Isn't technology great? And isn't it a pain in the fanny? All right. Well, you saw in what you can get out of that video, Scott is competing in Poland in track and field. He's had bladder cancer. He's online, and as soon as we can get him to share his story, we will. But I'm going to go ahead and go down the line. I showed you during the break, there were slides of people thriving and surviving, pictures of our panel. I'm going to start with Carlos. Why don't you tell us a little bit about your experience, Carlos, and then tell us how you're thriving and surviving. What are you doing?
Sure, can everybody hear me okay?
Yeah.
Great. I was diagnosed, well, actually, I'll go back even further for the symptoms. I had symptoms of blood in the urine in the fall of 2016. I wasn't, I thought nothing of it. You know, I was doing a lot of working out at the time, and I thought it was something really minor. I thought it may be a kidney stone at the worst. My wife, Angie, who's a nurse, she convinced me to get it checked out. So I went to my urologist, and I did an initial visit, and he scheduled me for a cystoscopy and a CT scan, and to check it out. And I still thought it was a kidney stone. But he did the cystoscopy, which is the first one I ever had. It was really an unpleasant experience. And then he said that I had 2 tumors the size of a quarter in my bladder. So it was biopsied. He did the surgery 2 days later, and it ended up being cancer, T1HG.
That means high grade.
It was high grade. Then I went for a second opinion, went to Ohio State. They gave me a second opinion. They did a second TURBT to stage it. And I went through a regimen of BCG treatments. I did the initial induction phase of 6, and then I went to a maintenance phase on a schedule. And I had 18 BCGs total out of the 27 that they recommend for the protocol. My BCG treatment was cut off at 18 because of the BCG shortage. As far as thriving and surviving, I really thank my wife, Angie. She's really my angel. She saved my life by getting me to get checked out. You know, it could have been a lot worse of an outcome. And we are thriving right now. We moved to Charlotte, North Carolina, from Ohio. To be near the grandkids. And then we're thriving. We have a lot of friends. I was working in Charlotte. I got another job that I really enjoyed. And then my dear wife ended up with she had blood in the urine. So we said, we know what that could be. So she went to her initial primary care doctor, and they gave her the usual, it could be a UTI, could be this. He said, we want to see a urologist. We want to see my urologist. And we saw my urologist in Charlotte, and sure enough, it ended up that she had cancer. She has UTUC. I'm not going to say too much more about that because she's got her story to tell.
Tell us, what do you do for fun these days?
Okay, what I do for fun.
The thriving part.
The thriving part, you know, that's a surviving. Okay, we'll go to the thriving part. Well, first of all, I'm like Scott. I compete in my age group. He competes in his age group. I compete in the 65 to 69 age group as a master swimmer. I'm on a team in Charlotte called SwimMac, and we compete in state level meets and also at national level meets. My specialty in swimming, well, what I do the best in is a 200 butterfly. And probably the reason why is because it's a really hard event, and not very many people my age group, even at the national level, compete in it. And you know, you have some ex-Olympians actually that compete in some of these national meets. But I managed to, over the year, since I've had my cancer diagnosis, I've won one silver medal and 2 bronze medals at the national level in 200 butterfly.
Did we ask you to bring a medal with you? Did you bring a medal?
I forgot. I got a picture of the medal,
Yeah,
but
it's
I.
hard to get it through
I
TSA.
didn't bring it. But I do that, but I also I'm in the Charlotte area. I'm a curriculum manager for a group called Senior Scholars. And that's a group of, it's about, I think membership is about 500. And it's older adults, 55 and over, who meet on Fridays, and we try to get speakers lined up. So I work on lining up speakers, science-related speakers, because I have people that have other curriculum managers that get history and art and stuff like that. But my focus is on getting science speakers. So I've got speakers on space exploration. I got Dr. Zubrin for space exploration. I got Dr. Andrew Knoll for paleontology. He gave that via Zoom because he's out of Harvard University. He wrote a book, A Brief History of Earth, 4 billion years in 8 chapters. I also got Dr. Mike Milowski, Matt Milowski, from, he gave us a talk on bladder cancer to our group in Charlotte.
Way
So,
to raise awareness with people
Yeah,
that
we're
might
raising
not have heard
awareness,
about
and
bladder
it's
cancer.
a lot of fun. I enjoy swimming, but I also enjoy getting really good scientifically oriented speakers. We got a speaker on the James Webb Space Telescope for our group. And I'm really happy to do that and, contribute to science and also compete in swimming. And I also run. I'm also competing in running at the senior games. I probably won't do as good in running as I did in swimming because I'm a weaker runner. We went to Ohio when we were living in Ohio. I competed in the track events at the state level, and I got quickly eliminated doing the 400, 800, 1500 meter runs. But we're thriving. My wife and I are thriving. She has her cancer and my cancer. We still do a lot of things. We're still very active. Last fall, we took a cruise to Norway and Denmark. Had a great time. We have a lot of friends in the Charlotte area, and we can honestly say we are thriving. We are living life. We are both retired now, so we're living life to the fullest.
So now, Angie, what he didn't already say about your situation, you've also, we'll talk to you later about caring for your loved one, the person that you're married to, and then turn around and you get to be a patient too. So you have a different experience.
Exactly. So, yeah, both experiences I have. And then I'll start with Carlos's cancer as a caregiver. Carlos always has been active, always ran and swam. His diet might not have been as good as it is now. Not that he was a junk food eater, but he's like salads a vegetable, So after his diagnosis, I'm like, you've got to up these. So I was the smoothie queen with all these things, the green smoothies. So I'd put everything in there for him. And I have to say now, 6 years out, you eat quite a few vegetables, and I don't have to blend them up with like apple juice or something, So that's been a plus. So then, he's doing well and thriving. His cancers never came back. He goes in for his scans, et cetera, and it's always looking good. Yay. Then we're in Charlotte, life's good, everyone's happy. And then, oh yeah, blend the urine, like he said. Right away, I went to cancer in my head at this point because I had no symptoms of anything else. So then I did call my family doctor and said, I bled my urine, and she was, oh, it could be a UTI. And I'm like, I don't think so. And I ended up contacting his urologist that was doing his scans, et cetera, and got in with him. I did take antibiotics though, just in case, you know, right?
It was a UTI, maybe.
Just in case it was a UTI, I figured I'd hedge my bets, right? And then was diagnosed with that upper tract. And so that threw me for a loop because in the beginning, I thought my results would be like his. Bladder cancer is bladder cancer. You know, I didn't know about the differences. And so then when they said, no, yours is in the kidney, let's take your kidney out. And I was like, wait a minute. Wait a minute, that's not how it's supposed to happen. And thank God for Beacon. Carlos was already involved with this group then, and Stephanie and Angie Smith, Dr. Angie Smith, ended up getting us in touch with some great doctors in North Carolina. So instead of just removing my kidney, like next month, you know, we did that neoadjuvant chemotherapy, which would give me some better odds. And, you know, I'm like, I don't, you know, if it's 5% or 8%, 10%, whatever it is, you know, let's take it because that'll add up, you know? My age, I was young, I was healthy, you know, you add all these pieces up and it's gonna help. So I did the chemotherapy. Rough, not just on me, but now Carlos is the caregiver. So it was rough on him too, you know? But I had surgery, I had chemo, had surgery, everything went well. And it was a month later from my surgery, we're at my high school reunion in Florida. So, so I was whooping it up. And I've been trying to whoop it up ever since. So like Carlos said, we went on the cruise. It was our first ever cruise. We had never been on one before. I know some people take like 3 a year, and we had never done one. We had a great time. We do like to do things, and if you saw some of those shots previously, one of those was in Colorado, going down the White Rafter, the river. Yeah, so we try to have fun with him swimming, and we travel with it. Like we went to Albuquerque. I'm like, well, I'm going on a balloon ride. You know, I'm gonna go with him, but I'm not just gonna sit and watch him swim. I'm gonna schedule some things for us to do too. So yeah, I do that. But yeah, so we've been each other's support. We don't have the same experience with our cancer journey. It's only been 1.5 years out for me since my surgery, so I'm still freak out a little bit. I have my 1.5 year checkup the end of April. And just like we talked about yesterday about anxiety with that, yeah, my head can sometimes go there. Like, oh, you know, what are they gonna find? But I'm doing well, I feel well, and I'm back to what I call fun Angie, you know, normal and having a good time. So I'm thriving. I still get a little twinges, you know, but I'm thinking the longer you go out like he is, the easier that's gonna ease up. But I have a good time during the journey and now, and even here in Phoenix, you know, this is the first time in Phoenix. So we like coming to these seminars, meeting all you people and having a good time.
Some of our groupies, you know, so they do follow us around, which is great. So let's just try one more time. Scott, can you hear us?
His Wi-Fi cut out, so he is not
Are you able to
on.
come in over audio? Oh, darn. Okay. Camille and Doug, why don't you guys go next, and then we'll save Gail for last.
Whoop, hello? Thank you, Stephanie. So I'm Doug, and this is my wife, Camille. And my story is probably fairly typical in terms of the way the bladder cancer presented itself. I have no risk factors. I never smoked. I never had any exposure to chemicals or anything like that. And I had no symptoms. My bladder was perfectly fine. And in mid-April of 2020, just as COVID was really hitting and everything was closed down, doctors' offices, operating rooms, et cetera, ERs were full of COVID patients, et cetera, and it was a very scary time. I'm getting ready for bed on about 11 o'clock on a Sunday night. I go to empty my bladder, And instead of what I'm normally used to seeing come out, it was pure blood and blood clots. I mean, we're not talking about a spoonful here. It was just pouring out blood. And I knew I was in big trouble. I said, Camille, I'm in big trouble. And but I didn't want to go to the emergency room that night because of all that was going on. And I knew nothing would happen. I'd just wait there until the morning. So one advantage of COVID was that there was a great access to care for those who needed it. So the next morning, I called my primary care physician. He scheduled me a CT urogram that morning. I went and saw the urologist that around noon that day, who reviewed the CT urogram and said, you need a TURBT. Can you do it this afternoon? To which I said, I don't even know what it is, but I guess I can do it. So I had the TURBT the same day. And the pathologists weren't busy either, so I had the pathology report about a day or so later. So everything happened very quickly. The original pathology report showed, for those of you who know how this all works, a stage TA, high grade. It sounded pretty scary, but the physician told me that it's TA, it's pretty good, don't worry about it. Anyway, I ended up going to see a urologic oncologist who was really excellent. His entire practice is bladder cancer. And we repeated a TURBT a few weeks later for staging reasons. And it actually came back T1 invasive into the lamina propria, high grade with CIS. And actually, when they reviewed the pathology from the first one, it also was the same. So I was T1 high grade with CIS. My surgeon said, you're a candidate for BCG, and we can provide you with full-strength BCG here. And I had a 6 weeks course for the induction, to which then we ended up doing another TURBT after that to see how it went. And the reason that we had done a TURBT instead of a cysto was because my surgeon had gotten the blue light was capable at that time, but only in the operating room. So we did it in the operating room. She told my wife, this is going to take 10 minutes. There won't be anything there. Don't worry about it. But if something's there, I'll just take it off right there. Ended up being a 2-hour procedure, and my bladder was absolutely full of tumors, almost like it was laughing at the BCG. Didn't really do anything at all. So my surgeon basically came out and talked to us and said, you could have some other conservative measures, but your bladder's declared itself. You know, if I were in your shoes, if you were related to me, I would recommend getting a radical cystectomy. And that's what I did. And so in January of 2021, I had let's see if I can put all this together, a nerve-sparing robotic radical cystectomy with ileal conduit. And the surgery took about 8 hours. The surgery went very well. I mean, to me, it seemed like it took 5 minutes, right? Because I was under general. I woke up in the recovery room. It was over. And my life changed that day in a different way, not necessarily in a worse way, but in a different way. I was in the hospital 6 days. Everything seemed to go well. I had lost quite a bit of blood, so I did require a transfusion. But I went home day 6. Three days later, I started to develop shaking chills and a fever over 102. And my wife said, we got to take you in. And I said, no, I don't want to. I don't want to go, etc. Anyway, we contacted our surgeon. And she said, well, you know, I mean, it's COVID everywhere. I mean, you could have COVID, but let's get some blood work. And Camille, you know, got me into the car with our daughter too. And we went down, got some blood tests, and it showed that I had an infection in my blood, septicemia. So I was readmitted for another week on IV antibiotics, had a drain put in, etc. So it was a little bit of a rough first few weeks, but slowly but surely I was able to recover. And probably by around week 6 or so, I was feeling pretty well. I would say I was maybe 70% back. And by 6 months, maybe 90% back. And by a year, maybe 100%, close to 100% back to where I was. And everything's worked well. I haven't had any problems. It's just what I predicted it would be, the outcome. And now all I do is I get annual CT urograms and blood work. And in fact, I've got one coming up in about a little over a week, my 1-year CT urogram. And people talk about anxiety associated with these CT scans for surveillance. And I just thought it was kind of cute. A friend of mine who also has cancer, he has a melanoma that's metastatic. He calls that scanxiety, which I think is a cute term. I don't know if he coined it, but it's scanxiety. So I've been thriving. You know, there's good days and bad days for the first year or so. I've been thriving. I'm very grateful to my wife, Camille, who's beside me today and has been beside me throughout the whole course. Excuse me, I'm breaking up a little bit. That's the microphone, not me. But, you know, in addition to Camille, I want to also say that there's other people too. Our daughters were there to help. Mainly they helped Camille because she needed a break at times. Friends brought over delicious meals. My surgeon was always there to answer questions and to talk me off the ledge. There were wonderful nurses. In fact, one of them who was aptly named Blessing, and she really was a blessing. She got me through the BCG and a whole bunch of other things. And I also want to thank BCAN, because some of the people that really helped me get through it all were BCAN survivor to survivor volunteers that I got linked up with. And it's just, there's nothing more powerful. You can talk to doctors and nurses, but there's nothing more powerful than peer-to-peer support. Because I can tell you that my surgeon knows a lot, and she's amazing. She doesn't know what I know about living after radical cystectomy or these kind of major surgeries or even BCG, because none of them have had it. Only we as peers can provide that support to each other and answer those questions. And we're not talking medical questions, but questions from the experience perspective. Talk about thriving. I know that's one of the questions you asked, Stephanie. If you ask me, how do I thrive in life, or how do I plan to thrive in life 3 to 4 years ago, before I got diagnosed with cancer and when I had just retired after decades of hard work, I would have said, oh, my plan to thrive is to travel the world and hit everything on my bucket list. And I would say now that my perspective is very different. Right now, to me, it's more simple things. And with gratitude, living every day you can. I mean, not always successful, with gratitude and being present. And I know that theme came up yesterday, and Stephanie brought that up too. I really think it's important to be present, because when I look back on my life, I spent all of my life either thinking about things I should have done differently in the past or worrying about the future, but I missed the moment, this exact moment. So on the days that I feel I'm thriving, that's what I do. I try to be present and be grateful. And on that note, I'd like to thank Stephanie and the BCAN team, as well as our wonderful corporate sponsors for hosting us today and getting all of us together. It's so nice to be in a room and looking at people instead of little boxes on my computer screen. So this is really wonderful. Thank you, Stephanie, and to the sponsors as well. So what do I do to thrive? What are my activities? I love to walk. I'm not an athletic champion like some of the other panelists. And maybe I could win a thumb wrestling contest, but that's about it. So I like to walk, and I like to be present when I walk. So I listen to the birds. I feel the sun and the wind on my face. I smell the smells of nature, you know, out in the forest and things like that. That's how I thrive. There's nothing better than spending time with our grandkids, getting down on the floor, playing with them, entering their world. It's very important because they're always present. That's the child brain, right? I like doing things with my hands, so I'm starting to learn to do oil paintings. I bake bread and I knead the bread. And last but not least, Camille and I both feel strongly about paying it forward. People helped us, and so we've been volunteering with a lot of organizations, one of which is Beacon, and we are survivor to survivor volunteers. And I'll leave some of that more to Camille, give her something, to really expand on. Yeah, I know. I didn't want to cover it all, but so we do that. We've been doing that very actively for the last 1.5 to 2 years, and it's very rewarding. So I'll turn it over to Camille, if that's okay,
Yeah,
Stephanie?
Absolutely. And I think having a diagnosis that started at the same time as the pandemic really changed the whole dynamic. Were you able to go in, Camille? So you weren't
No.
even able to
Excuse
be
me.
there.
And so that's, I think that's a good place for me to pick up from,
Yeah.
because the diagnosis itself, was shocking. And when Doug went into the hospital that next morning, it was a whole day of him just texting me and telling me, okay, I'm going over to radiology, I'm going back to urology, they're gonna be doing the surgery this afternoon. It's a good thing I didn't have anything to eat or drink this morning, and those types of details. But the uncertainty for me in not knowing anything and essentially waiting in the parking lot for the next text message or, update was actually quite difficult. And to be honest with you, at the end of the day, after he had the TURBT and the surgeon called around 8 o'clock that evening, I definitely did not expect him to say there were 2 tumors and I think I got it all. And, he's going to be okay. So for me, it was shocking. It was like, what? Just this disbelief. And even more so is shortly after that, the nurse called me to say, okay, you can come and pick him up now. It was like, okay, now you're just going to send him to the sidewalk, and what do I expect with all of that? So, the catheter and the drainage bag and the recent surgery and the diagnosis, and of course, communicating with our daughters. So at that time, like Doug said, we were hopeful that everything was going to be okay, and then of course you have the BCG conversation, and then you're hanging on to that hope each step of the way, which is really important because you're bearing a tremendous amount of uncertainty. And one thing that really helped me through it, I think, was just because of my own sort of contemplative groundedness, and I'm also a retired nurse. So all of those things were very helpful for me in trying to maintain some kind of balance. And also as a caregiver, understanding, it's okay to have some self-compassion. It's okay to try to take care of yourself. And that came weeks after the surgery and months of tests and all kinds of different things. And grateful for our walking. That was very balancing. Trusted confidants and colleagues that we could talk to and co-regulate with, very important. And one of the greatest gifts for me would have been just being able to step outside or step into another room, take a deep breath, and give myself permission to have a pause and just literally put my hand on my chest, and I literally would say, this is the only moment you have, and check in with yourself. How are you doing? What's being asked of you? What do you need? Really hard to ask yourself what you might need. Sorry. But you definitely come through it. And, we're heading into 40 years of being together. It's not our first rodeo, but this one definitely was a hard ride. I'm not going to deny it. And once again, just to remember that it's good to have people that you can talk to. And when you're with someone who has a listening heart, who can validate emotions, mixed emotions, and uncertainty, it can really help build your resilience. And that is one of the reasons why I love the Survivor to Survivor opportunity in supporting other caregivers, because they need to know that they are doing the best they can, the very best they can, and that it's coming from the right place, and it's okay to take a break if you need it. And as many people have shared and said throughout the summit this week, and a lot of things have been shared and totally agree with, and again, just understanding that it's a huge adjustment, and to be able to look at it with a new perspective. And it's a new normal, I guess, if that's what they want to call it. But I loved the adjustment words, because it is a huge adjustment. And you absolutely can still have fun. We love to go to movies, we love to walk, we love to travel. We just took a cruise ourselves in January for the first time in 4 years. And we had it's not just the one story. It was COVID, post-COVID, new grandchildren, elder care. I mean, life was moving on all around us. So to navigate one day at a time, do the best you can, and just, try to stay steady and really to know, I just thank God every day for all the angels in my midst and for the strength and the courage to move through it. So, thank you.
Now we're going to go to Gail, whose story is a little bit different. You were pre-COVID, but you have a very different story, Gail.
Let's see if this sounds familiar to anyone in the room. I had a very active professional career in which I invested all of my energy, all of my emotion, and a great deal of my satisfaction. I took my body for granted. I mean, it was always going to be there. I spent no time doing much of anything that wasn't work related. And then all of a sudden, I found that when I urinated, I felt that I had to go again immediately. I went to see my primary care. There was microscopic blood in my urine, and I was sent to a urologist. They looked around and they couldn't find anything for a while, did CT scans, did a lot of manual exams. And finally, my Christmas present on the 23rd of December in 2017 was to find out that I had muscle invasive bladder cancer. Okay, I'm working full time. I don't know what this means, and I feel fine. I really feel fine. I don't know anything about bladder cancer. I don't know anyone who's ever had bladder cancer. I don't know what to expect. And the one thing that I was able to find was the pamphlet that I think many of you might have been given from Beacon that had information about basics. So I did what anyone in the information professions do. I immersed myself in finding out everything that could possibly go wrong and all of the possible diagnoses. And I had a friend who was going to come with me to any of the procedures or any of the meetings with the doctors, because I live alone. And my son lives in Montreal, so that the family that I would normally be able to rely on was very far away. I had the staging surgery in January, and I still felt fine until they did a PET scan immediately afterwards. And I started to develop massive blood clots, gallons and gallons and gallons of blood clots. Upon being admitted to the hospital, prior to even meeting the bladder cancer team, I was lying there, and I'm hooked up. Every possible orifice is hooked up to something. And the doctors come in to visit me, and to give me their considered opinion. And they said, can you stand up? And I said, sure, I can stand up. So I hoisted myself out of bed, stood up, and immediately had a heart problem called an NSTEM, which is a bruising of the heart muscle, at which point everything ceased, and there were floods of equipment and people in the room. So I'm not in a great state. I'm confused. I still haven't had a real diagnosis. I really don't know what the treatments are going to be. And I've now had this complication. And I'm a person who has just taken for granted that I will be able to continue working, that I will be able to continue to rely upon my body to heal itself and do whatever it needs to do. Until the team came in, the urologists, radiologists, oncologists, and the various fellows, and they basically stripped away every option that I thought that I was available. No surgery, no chemo, no radiation. The only thing left was immunotherapy. And the odds were a fraction of a fraction of a fraction. So not great. And the impression that I got from the assembled medical professionals was that I should just probably get my affairs in order. And that when I said, should I retire? Should I quit? What should I do? And they were not particularly optimistic until they then left, and my oncologist pulled up a chair and sat next to me and said, I'm here to help. I'm here to be with you on the journey, and we're going to deal with this together. So I've had nothing but immunotherapy. It was the only option available to me. That was 5.5 years ago. I was very, very fortunate, and I benefited from all of the people that volunteered for clinical trials of pembrolizumab, Keytruda, which is advertised on television, as a therapy, not a first line, maybe not even a second or a third line, for bladder cancer. And I was one of the few that responded immediately. And after 5.5 years, I'm knocking on wood, or Formica, or keeping my fingers crossed, but there's no evidence of disease. But all of us know that there's always something in the back of your head saying, okay, you're fine now, but what about tomorrow? What about the next CT scan? What about the next cystoscopy? What's that going to? But I made a decision that I was going to tell everybody that I had bladder cancer. Bladder cancer is a cancer nobody talks about. Women don't talk about it. Women learn to talk about breast cancer. We learn to talk about ovarian cancer. We need to learn to talk about bladder cancer as well. And so I made a point of not only telling people that I had bladder cancer and what the treatment was, but what the signs were so that they could recognize it and so that they could pay attention and possibly identify the problem prior to the stage that I had. I had muscle invasive, high grade, CIS, metastatic bladder cancer. So if you remember Stephanie's iceberg, I'm sort of up there toward the top. I mean, cancer is not a competitive endeavor. So we don't compete with each other, but it was complicated because I wasn't able to get lots of the types of treatment that other people were able to benefit from. And while I wasn't an N of 1, as researchers talk about, there were not a lot of people in early 2018 that were only on immunotherapy. And so there wasn't a lot of history, there wasn't a lot of data. Now, because of the advances in research, there is a great deal more data, and that if you are looking at immunotherapy as either an additive to other treatment, or as, if you're in my position, the only treatment that you have a greater range of information on which to base your decisions. I spent a great deal of my professional career working with researchers, and so I care deeply about the advance of bladder cancer in its funding, in being seen as not just a hopeful condition to study, but an amazing one to study, where there are lots of breakthrough moments yet to happen. And so I'm really excited about that. And some of my thriving has been volunteering as a patient advocate for Beacon and working with pharmaceutical companies. I was privileged to work on the guidelines for hematuria and bladder cancer for SITC, the Society for Immunotherapy of Cancer, and being able to, in some way, give back to the community and help all of us to be able to have the kind of future that not only we want, but that we want to be able to pass down to our children and our grandchildren. And Beacon has been my ally, and it has been my savior, and it has been my passion. So I don't do a lot of swimming, I do a lot of walking, and I haven't gone on a cruise.
Maybe we should all take a cruise.
I
Beacon cruise.
I have,
We should have a Beacon cruise.
I have been able,
Yeah, right? This is an idea.
well, I think that a lot of I attribute a great deal of my thriving to participating as an active patient advocate in Beacon.
Thank you. It was very natural to find Beacon advocates that are engaged with us to say, okay, you guys are like examples for everybody. That this is a club you didn't want to join, but you got a lifetime membership. This is now your life. You might as well hang out with the friends, right? We're here, we're all friends, we're all in the same boat. We've done so much in the early years of just raising research awareness for bladder cancer as a potential thing that could be researched, not just cut out, but find a better way. And for everybody to give back in their capacity. I love to say that Gail is also on the steering committee for our scientific meeting that we offer every summer, where we bring together this year 300 clinicians and researchers to really collaborate to find the next best thing for the bladder cancer community. I think it's really invigorating to see that we're able to make change. And you benefited from a treatment that wasn't even available 8 years ago, and it just came on the market right as you were diagnosed. So this is exciting opportunities. So now, what questions do you have about thriving and surviving? We had one question that came in over the Zoom. Thank you, Mark, for sharing. This is a question for Carlos. You mentioned that you had to stop the BCG protocol after 18 sessions due to the shortage. Do you or your urologist have any concerns that you could not get the full treatment and the long-term outcome of the reduced sessions?
That's a very good question. I was very concerned when I was told that I had to cut off my BCG treatments. I know the protocol goes to 27. My urologist, who's a very good urologist, said that most of the benefit comes in the beginning of the treatment and that I'll be just fine without getting the complete 27. They can be cut off at 18. I was still concerned, but I went to the Beacon Conference, the Beacon Summit 2019, and we had a panel of doctors, one of them from Johns Hopkins, and I, after the panel was over, I asked one of the doctors on the panel to corroborate what my urologist said, basically, that I'm in a good place, that I have a very low chance of recurrence if I don't get the complete BCG treatment. And it was corroborated that, right now I have about an 80% chance of not getting a recurrence, only a 20% of getting a recurrence. And right now I've been 6 years cancer-free. I'm very happy for that. But I also want to really stress the importance of Beacon and what Beacon provides. It provides a way where we can get answers to our questions that not necessarily our doctors can answer. Beacon has been very helpful, especially in the case with my wife Angie with UTUC. I didn't know anything, even though I had bladder cancer, I didn't know anything about UTUC. I reached out to Stephanie. Stephanie, like we said before, got me in touch with Angie Smith, and we got answers and we got a great treatment for my wife. Another example is a friend sitting at the table, Brian Okamoto. I reached out to him on Inspire. We connected. We were diagnosed with the same disease at just about the same time. I'm a swimmer, he's a swimmer. We have a lot in common. I was in aerospace, he was in aerospace. We helped each other. We helped each other. My wife helped me. It's about helping. We're a community. We have the disease in common. So let's work together to try to fight this.
This is good. I think it's really impactful. One of the things you mentioned was a second opinion. Sometimes patients don't want to go. People with a diagnosis, I should stop saying patients, the individual with a diagnosis doesn't want to get a second opinion because I don't want to make my doctor mad. Or maybe they'll think I don't have confidence in them. A second opinion can validate what your physician is telling you. Wouldn't that make you feel better if somebody else is saying, yeah, you're on the right track. This is what I would also do for you. Or it can open up opportunities that you go back and then you ask more questions now because you've been educated to say, let's talk about this other option. You didn't mention it. And then your doctor might say, well, yeah, we could pursue that. And so a second opinion is never a bad thing. I think Dr. Linehan will agree with me that she's not feeling insulted if somebody says, I'm going to get a second opinion. It's not because they don't trust her, because you see, she's very trustworthy and smart. She knows what she's doing. So it's just a chance to be your own shepherd on this. This is your journey. You are the one who is deciding which path you're going to take. And you should be involved in those decisions. The more education you have, the better you're going to be at making decisions that you can live with. Live with in the sense that you're comfortable with, and live within the sense that, yeah, you're going to keep going. You're going to stay on this side of the daisies. That's the point. So I think it's very important to consider a second opinion, and a lot of people don't do that because they don't want to make their doctor mad. So I don't think if your doctor gets mad, they're not the doctor you need to be mad at. Okay? That's just my personal opinion, okay? Not a Beacon opinion, that's Stephanie Chisholm's opinion. Any other questions? We've got Bernadette here with the microphone. Raise your hand if you have a question for anybody. Any other thoughts that you guys want to share? Because this is really, great examples of people doing great things, and of course they're helping Beacon too, which is really helpful.
I'll piggyback on that second opinion. Now we're in Charlotte, North Carolina. My husband's seeing a urologist there at a cancer center. Might not have been a National Cancer Institute, but it's a very good cancer center. But that doctor just wanted to take out my kidney. And we're like, wait a minute. You know, I'm, oh, sure, you know, go ahead. No, so it was more like, let's look into this. And so we researched and we got that information. And I went up to Chapel Hill. So I ended up having that neoadjuvant chemotherapy before they took my kidney. But where do I go? I still have a port. I want this thing gone, I have to tell you. But I guess I'm resigned for a while to keep it. I really do want it gone. Reminds me of my cancer, and it's just not nice. But anyway, so I have to get it flushed, right? I'm not having chemotherapy anymore. And so where do I go? I go to the cancer center. Yeah, the same one. His doctor's the one who writes my order. So I go in there and get my port flushed. So it's fine.
And there's no hard feelings
And
between
he
doctors.
still goes and sees him and gets his
There's-
cystos there.
The doctor I have did not get offended in the slightest that Angie, my wife, went to
I
Chapel
just,
Hill.
yeah. So so it's all good, in other words, you know? So I drive up, 3-hour drive to Chapel Hill for all my treatments, and then we just go downtown for Carlos. Everybody's happy.
Just one other quick comment. Stephanie asked us to think a little bit about what makes us optimistic. And I am very optimistic about the future. And we've heard a lot about immunotherapy over the last couple of days, and I don't think most of us really understand immunotherapy all that well and how it differs from chemotherapy. But the advances in immunotherapy and genomics that's coming out with research today is just astounding. Keytruda, which was the first of these drugs, has only been available for a few years, and I think it was only
Mid-2017.
Yeah,
So
but-
if I had been diagnosed 9 months earlier, it would not have been available.
would not even have been available. And I wonder if it was used as an off-label for you because
No.
it was
It had been
on-label for
approved
bladder.
in the middle of 2017 for bladder cancer,
Okay.
but not as a first line.
Not as a first line. And Opdivo, which is another immunotherapy drug, came out even later than that. But one thing that I really thought was amazing was that some companies, and maybe some of our corporate sponsors are even working on this, are looking at creating cancer vaccines. And I think Moderna was the one that used its mRNA technology to create a vaccine for high-risk malignant melanoma patients that's being tested very successfully, I think along with Keytruda, and they enhance each other's effect. And I'm just thinking, is a bladder cancer vaccine somewhere in the future?
Interesting that you say that. That is a topic that will be discussed at our think tank this summer. So our steering committee is already on top of it. So look for exciting new things as we bring more and more people, and they bring in people that are successful in other diseases to share what's working and how they can apply it to bladder cancer. That's what the think tank does. It really inspires.
It sounds so exciting. And, unlike Keytruda and Opdivo, et cetera, which are great drugs, they're generalized. These are customized for the individual, where they actually take some of the tumor cells and they create the vaccine specifically for you. And I'm just thinking, in addition to bladder cancer, imagine a future, which is probably not that far away, where women that have the BRCA gene and who are currently today getting prophylactic mastectomies could instead, right? Is it coming too?
Oh, yeah.
This is all coming. It's extremely exciting and gives us a tremendous amount of hope and optimism. Imagine, getting a vaccine for your high risk for breast cancer or bladder cancer, or any of these things, and forgetting all the things that we've been talking about the last forever number of years, BCG and the like. So a lot of great stuff coming.
Stephanie?
Yeah, one last thing.
Doug talked about the reaction that he had to the surgery. One of the hallmarks of being able to move forward with all of the additional drugs and the drug therapies that are going to be available is if people participate in clinical trials and if they report the kind of adverse reactions that they've had. Unfortunately, I had a unique, so far, adverse reaction to immunotherapy 5.5 years after 5.5 years of treatment. I developed immune-mediated colitis, which means that I may or may not be able to rely on immunotherapy if the cancer recurs. But if I didn't make a point of making sure that my doctors knew about it, if you don't make a point of making sure your doctors know about adverse reactions, then the kind of data that gives all of us as patients the opportunity to assess the risks and make choices. We don't have the kind of data that we need. For immunotherapy, there isn't a lot of data. At the point where the original clinical trial was 2 years, at the point where I had 2 years of immunotherapy and was doing very well, the option was to stop and just trust that it was going to continue. But there wasn't a lot of data because it had only been approved in 2017. And now I had to make a decision. So the decision I made was to be able to continue thinking that more information would be coming in and more data that I could contribute to and others could contribute to would help people make decisions. So I can't stress enough the kind of feedback that your doctors are asking for. If you have constipation, tell them. If you have diarrhea, tell them. If you have skin rashes or other reactions, let them know, because you're not just helping yourself, you're helping all of the people in this room and all of the thousands and thousands of people that have bladder cancer and who are relying upon data and information for the research to progress.
Quick question, last question, because we're going to do one more program before lunch, so go ahead.
I'm still John.
Yeah.
I like going north and water skiing in the summertime. If I have my bladder out in the first part of May, what do you recommend, suggest for conditioning to get back in shape so I don't lose the whole summer? And if you had experience with that, I would like to talk about it.
Okay, so John's looking for anybody with the experience of getting back in good condition so he can continue to water ski and do fun things after he has his bladder removed. I know we talked a lot, so find John at lunch and give him your insights, but we did talk about sort of this preconditioning, the prehabilitation, and then the rehabilitation and everything in between. There are lots of options. Talk with your doctor. And, obviously, Dr. Sarah Sutka, who just got our almost $1.5 million 3-year translational research award, her research is all about prescription exercise to get you ready and then help you heal after the surgery. So it's a very important topic, and there are some people making really significant advances there. So I'm going to leave it at that, and thank you so much, everybody, for sharing. It was great. And we're going to end this webinar and start the Patient Research Advocate webinar, because when I send out the follow-up with the link to the evaluation, which you will be getting,